Amara, first I'm going to remind you about her speech title, and then I will talk about herself a little bit, and then I will leave your stage, Amara, dear. So she's going to talk about pre and perinatal body psychotherapy with adults and kids today. And she will present two case studies. And Dr. Amara Eckert is a professor at the University of Applied Sciences Darmstadt, specializing in pedagogy, coaching, psychomotricity, and body psychotherapy. With over 40 years experience, she had taught at multiple universities, including Cologne, Kiel, and Maltepe in Istanbul. She has advanced training in various psychotherapeutic approaches, has worked therapeutically with children and adults since 1980. A lecturer for institutes and NGOs worldwide. She focuses on psychomotricity, trauma, and prenatal and perinatal psychology. She is also active in coaching, supervision, and leadership, with professional publications in multiple languages. And Amara is my best friend. Thank you, Amara, for joining us today. And this is your stage.
Thank you so much, Nesha, for introducing me this way. And thank you to Prenatal Alliance to invite me to this conference. Can you all hear me, by the way?
Yes, perfectly.
Yeah. Thank you. Thank you. Yes, I was, need to say, I was touched by your lecture, Joel Evans, because what you said, it's very natural for me in my daily practice. And you presented it in a very natural way, and that I really, really appreciated. So thank you again. I need to say this. Yes, I don't name the spirituality very often. Sometimes I do it because it's so easy misunderstood, but I'm teaching this way. Now I will come to my lecture. Oh. You can see it, I think.
Yes.
Mm-hmm. What you see here is one of the caves that kids like to build. And as Joel even said, I learned everything from my clients and with my colleagues. And sometimes a few things from the books, but not so much. But anyway, okay. And what I'm going to talk about first are basic assumptions of pre- and perinatal psychology, just to remind you. And then body psychotherapy with kids and adults, and early experiences and topics. And then I'm talking about the cases. So the basic assumptions. Implicit is that there is an implicit memory about experiences since conceptions are stored in the body's implicit memory and affect how we feel and behave. This implicit memory you can call cell memory, but to be more open what kind of memory it is. Maybe it is more a memory that is on another frequency. We call it implicit memory. Ovaries and uterus are the first home conception of the basic attitude to life starts here. So here we have the start of our life issues. Conception, implantation, and birth are life-shaping transitions. And as we had that lecture from Joel before, I need to add, maybe there are other conditionings before you come to, before the soul enters the body, before the soul enters the egg. I don't say it so often, but this needs to be taken in consideration too, that there is something before preconception. Now, body psychotherapy works with body memory, the emotional, the mental, and the physical body energy. So we work with the energy and we work with the mental, emotional, and the body. The goal of body psychotherapy, there are many schools, of course, and I just say it in a very limited way. The goal is unity, liveliness, and connectedness to one's own heart, and of course to one's own body. But to let you know about my focus, it's of course a body, but it's always the heart, at least, because the heart is a huge transformer of pain and a huge transformer of energies that are difficult to bear. Pre and perinatal body psychotherapy is based on the assumption that fundamental life issues are rooted in pre and perinatal experiences. These imprints express themselves differentially at each stage of life and requires age-appropriate methods. So this was my experience. As you see, I don't work with babies. I sometimes work with pregnant women, but I work with the imprints in later life periods, and I see that they are really different in each stage of life. So this is the childhood. This is the body psychotherapy for kids, which I call, or we call, psychomotor therapy. And it's a mindful-based psychomotor therapy. And it's a psychomotor therapy that is not training, but it is working with life topics. It uses the body to work with emotional topics of kids. And here you can see a father rolling his son in this tube. And for this son, the topic was, one of his topic was divine homesickness. And he was showing it in everyday life. And here he was showing some parts in play. This is the second one I wanted to show you on the left side. An adult expression. These people have never known about these topics, and they were just trusting and going to the middle and sitting down and being carried by the whole group. And before this woman went to the middle and was carried by everyone and connected with everyone, she had a very sad expression in her face. And in the moment she was carried this way, and she was carried mindfully, her life came back to her face and she looked very happy. There's another expression. What you see here, by the way, it's not therapy, it's just a group supervision and an experience to resource the people. So what you see here is the dancing stuff. This is response more to the egg period dancing joyfully and being together in this kind of stuff. Or you can talk on that picture you see, you can go by talking and work on prenatal topics by talking. So there are many possibilities to work. The therapist's attitude and prerequisite is important because he should have a mindful, resonant research. He should go by research in a mindful and resonant way. So this kind of body psychotherapy is actually a practical way of doing research. You never know where you go with the people. You never know where you're going to end, and you never know what will be the way of the people. The same like in pregnancy, the same like in birth. You have to go the way by walking. And that's your attitude as a therapist. You need resonance, body emotional resonance. This is the basic. Without this, nothing happens. And you need to question in a bodily way, in a verbal way. Then you can do action, maybe touching, maybe moving. And then you start understanding a little bit from the other one. And then you go on and you start understanding the next little piece. So you go on and on and on, understanding piece by piece. And it is important that the therapist has worked on his own pre- and perinatal imprints, that he can see and understand the expression of the emotions and the body. Otherwise, he might have other hypotheses. Of course, we always work with hypotheses. We never know. The client knows, not the therapist. So let's name some stages of where usually you find these issues. We can quickly go over this. It is, of course, a sperm journey, the moving of the sperms, the egg journey, how that works, the conception, how that had been, the implantation, which is a quite important and difficult journey for many people. There's a period of joyful play in the womb in the third trimester where you can easily start. When you start that topic, it's better to start with resourcing and with joy. Of course, birth, the welcome after birth, and the discovery when the parents felt that they are pregnant. And if the person is wanted or refused, it is a huge impact to be a wanted or a not wanted child. The umbilical effect, if you are an alone-born twin, if you have the wrong or right gender, if there is a prenatal diagnosis which might hurt you and cause trauma, if there's assisted reproduction or if there are drugs involved. So many, many things. And about the reproductive technologies and birth variants, of course, the assisted reproduction, the primary and secondary cesarean, forceps, vacuum, contraceptive drips, PDR, or narcosis. And now it's important to say that it's not easy to establish monocausal causal relationship between early life experience and particular problems in life. There are many early experiences that probably cause the same later problems. On the other hand, repetitions can be observed especially on the subject of self-determination. For instance, in IVF, you have IVF, then you might have a difficult implantation because you were already limited in your self-determination. And then you might have a cesarean birth, of course, and again you are limited in your self-determination. So you have three repetitions in this subject. Another one is having anesthesia before, and then maybe unfortunately you have forceps or cesarean. Again, you are limited in your self-determination, and that has a huge impact on your life. Now the topics which I observed in people, in younger people and in adults, so every age. So this is a topic of disturbing anxiety and panic in life. If you have this, there were experiences before. Dissociation in transition, this is a huge topic I came across, especially with my students when they had to do their PhD and master degrees. I did not talk about birth, but I knew what happened to them in birth, the way they did their thesis. So with this knowledge behind, I could help them in this transition. And I sometimes felt like giving birth to them in these situations. A strong urge to control can be an outcome of not being allowed to be self-determinated. A strong aversion of being controlled. And many accidents with injuries, this can come along with drugs, with early drug experience and other things, and also implantation stuff. Make your own way at all cost. This is a so-called, so can say positive way of dealing with not being self-determined before, but it can also be related to birth, which is to induced birth. A lack of drive or self-loss in self-determination, I said that. Test anxiety, of course, a transition topic, and cannot show themselves with their potential. It often relates to not being wanted or not being welcomed, and the fear of being in the center of attention, same topic, and unable to trust and feeling of unwantedness. So, and there is much, much more. And all these topics can occur in many, many shapes, in many, many stories. Now we go on, and we have the first case. This is about Jana. She is 44 years old now, and she is a high sensitive survivor. And one of her topics was implantation. And one of her topics, we will see now, is an alone-born twin. So she was a third child. She was unwanted. And her father had attempted an abortion by kicking the mother's womb. And then her twin died within the first 3 months. We found out about this during therapy. And her mother refused to do abortion, even if the father forced her to go to the clinic. In the clinic, she stood up and she said to the doctor, "I want to have this child." So you can imagine that Jana also has a lot. Jana was a strong woman with a lot of resources. having a mother surviving all what this. I work with her in the 9th year now, but we had lots of interruptions. So the first agreement coming together was she wanted to explore herself in body psychotherapy. And in the first session, we had, I met her in a group, and in the first individual session, she was lying, she wanted to lie down, and when she lied down, it was in an embryo position. And I immediately worked with her in this position about her feeling and her sensations. And she had lots of sensation, like being in the womb. And then there some pain of moving and of losing occurred. And in that moment, I asked her about if there's someone else with her. And she immediately agreed and said, yes, there's someone else. So we explored her twin. And we started to talk. In the first session already, we started to connect to the twin and to find out a part in the body where she feels connected with the twin. And she started talking to the twin. And then she stood up, and before she left the session room, this twin was like an anchor, someone she could talk with, someone who could be with her if she likes to address this twin. And she went out quite touched and quite happy. After that, we did not see for 2 years because she doesn't live in my area. And then after 2 years, I came to her area, and then we started sessions again. And then she started working with her limits. She had a relationship at that time, and she could not find her own limits in that relationship. And again, we started with the childhood, and later on, so it took some time to work out the relationship issues, and I saw that it was somehow a twin issue. It was not only the issue with the parents, it was a twin issue. And it took us some time. We went on working online, which is not that easy, but it worked. And finally, we came to the twin again, and after many sessions, she hugged the twin, and she felt the way she felt in her relationship, and she was not easy that her partner was always saying goodbye to her, not showing up for 1 week, not giving mails to her, and she felt like quite desperate. And with again reminding the twin, she felt better and she felt resourced. Again, we had 1 year break, so she went on with that relationship. And after that year, she showed up because she had many accidents, she had illnesses, and she was working for 2. So she was working like hell. She is, by the way, she is a psychotherapist herself. And she has many clients, and she was also working with these illnesses. We started to work with that illnesses and it came up that it was a topic of rejection and a lack of appreciation, and we found out herself not being wanted was showing up. Herself not being wanted, and the abortion was showing up. And so we were working on that pain of the abortion, the tried abortion, and the not being wanted. And this was successful again. And again, she had a 1 year break. And after that, she was showing up again online with a new relationship. and with limits. And she was really proud to tell me that now she had a partner who was very close to her, and she found out her limits. And at the same time, she wanted to work on another topic, and that topic was her role as a daughter. So that she sometimes her mother became her twin. So the role, there was a role confusion, and we worked on that role confusion that she is the daughter of her mother, and her mother is not her twin. We did it by constellation, we did it by feeling online, of course, but it was possible as she is a skilled client. And she started finding a good relationship to her mother and finding her limits and finding her part. And then what happened, the next thing is recognizing and appreciation high sensitivity as a resource. Say it with simple words, she wanted to know how to use her spirituality in her life and in her work, because she told me earlier before, but now, that she can see what, if she connects to her heart, she can see what happens to the clients, and she can see what happens to other people. But she does not want to be intrusive to other people. And then I showed up, and we talked we found a way to talk from a colleague to colleague. And I told her how I work with these abilities. And I encouraged her to use these abilities and not to be afraid. It was basically the fear of her own spiritual and high sensitive abilities. At that time, the accident and the illnesses were gone.
Amara, can I interrupt you? Sorry,
Yes,
but your
yes.
time is up. Yeah, so I think you're gonna have one more case.
Yes.
Oh my,
Okay, so my time is over.
your time is over. Yes.
Okay, establishing a more
But
one-to-one.
you can finish, and if you like, we can skip the questions. But don't go for the second case, please. For the time.
Maybe for the second case, I say it without presentation. Okay.
But well, there is really no time.
Okay. So
Yeah.
let's finish this.
Okay.
She could establish a connection to her own heart as a resource and work with this. Okay, so I stop here.
Sorry.
And no, thank you, Nesha. You know me. You know
I
me.
know.
I can talk for years. There's so much to say. I can say for the second case with an 8-year-old child, this was a 6 month psychomotor therapy. And in this 6 months, she learned she was not able to build houses. And I helped her to build houses step by step. And within 6 months, she learned to build houses. And at the end, it was a kids group. She invited all the kids to her house and was the host. And she was really proud, happy. Her energy changed 100%. Before, she was very shy. And after this, she stood there like this with all her power. And her topic was attempted abortion and an unwanted child who learned to build her home. Okay, so this is it. And
Thank you so much.
very, yes, in
Yeah.
short.
Yes, yes. Well, maybe only one question can go to you, and then
Yes,
we can end it.
yes.
Us actually, have you witnessed traumas due to assisted reproduction, Amara? Have you witnessed any traumas about this subject? As
I
for
have supervised the kids therapy on this subject. Yes, many I've supervised, and but I haven't worked with adults on this topic yet, and not with kids yet. And is the question about how to work with this topic with kids? Is that the question?
No, I think it's going to be a very big subject, but have you witnessed or have you worked before?
I have yeah, in supervision. So the supervision topic is, you can see it very easily. The kids know how many eggs are frozen. The kids know where the eggs are. The kids know that the eggs are very cold. And the kids want the eggs to be part of their life. And they are suffering a lot that the eggs are not part of, the frozen eggs are not part of their lives. And the whole situation changes only when the parents talk about the IVF in front of the child. They don't need to talk to the child, but they need to talk in front of the child, not in an intellectual way, but in a touching way. So that means if you work with kids, working with parents is part of the work, of course. Yeah.
Thank you. Thank you. Sorry about to interrupt you, but it has to be for the other panelists. And
of course.
Thank you for being with us today. And all appreciation is going to you and to your work.
Thank you, and thank you all, and thank you, Neshe.